I think first of all, I would like to congratulate Dr. Adrian
Thank you.
and for completing the phaco training program with very good expertise and very good, I think, the attitude of learning. And I think you had not done a single case of cataract like in last 10 years, I guess.
No.
And but of course, you were involved in clinical experience and you were a busy practitioner in Romania.
I see a lot of operation.
And a lot of operations he was assisting. But I think this was his first experience when he started phaco, and I'm very glad to see the way you have progressed during your training course. So I would like to just ask few questions to you. And before that, I must congratulate you for such a impressive training and you underwent. So just to start with your the initial stage, like we always went stepwise when we started, and that I think do you think that it helped you when we shifted from wet lab to the stepwise learning? How did you feel when you started learning?
Very, very good, because if you learn steps, it's easier. And if you learn one step, you know what you have to do. And repetition is the mother of learning. And if you do one surgery from beginning to end, it's hard to manage all the things that happen in the operation. But if you do steps and you think only that steps to make it right, it's more easy.
So it's more focused, and as you rightly said, that any surgery is like building from one step to another step. And I think in last few cases you showed us that you really learned from the initial experiences and made it perfect in the future. How was your experience of the 3D videos that you were showing, even live surgeries you could see, and also some edited videos that you showed?
The experience with 3D is very good, because you see how you can do a thing. You have the ability to do it, but you don't know how to do it.
How the surgeon sees.
How
so
the
you
surgeon
know
sees.
how to see it through the surgeon's eyes.
Exactly. And if you watch the video, you can do that.
Yes.
And you are more confident to do it if you see.
And I was particularly impressed with your attitude that you always stayed in the operating room even when you don't have to operate. So you were always observing what I was doing or my colleagues were doing in the operating room, and that's very useful. So even if you don't have your own surgery, it's very important that you keep observing and analyzing things. And I think it's very good that you also learned about giving the peribulbar blocks to the patient, making patients more comfortable, adjusting the parameters of phaco. So how was your experience in handling the phaco machine? Because I think that is one important thing, apart from learning the steps and the technique. How did you started thinking about the phaco parameters, and how did you apply during your surgery?
The phaco machine is very good and helps you a lot in the surgery. And at the beginning you don't feel the power of the machine, but you observe if the anterior chamber is stable, if the power is okay when you enter in the benching. And you learn us, you teach us about the power and how to feel when you make a movement. And if you trenching it and you push the nucleus, it means you need more power. And if you push and nucleus come to you, you have too much power. And I try to adjust it. The vacuum and the aspiration, they are well set. You don't need many variations,
right? So
that
one parameter you are comfortable, and then you have to just do small variations.
And variation. And at the vacuum and aspiration, you have the possibility to press the pedal
in linear fashion,
and you get the power you want in some cases. And if you have only one piece of nucleus, you press lower on the pedal and stay only on the aspiration and give power only when it's
that's great. And I think one more thing is that you also learned how to tackle the small pupil.
Yes.
I think that's one of the issues in your early career, because you are doing even a normal case of cataract, uncomplicated, and during the procedure it goes down, the pupil goes down, and then you are tensed. So now you know how to put the iris hooks also.
Exactly.
So that can bail you out of any situation.
Yes. And your technique is better because you put on posterior.
Posterior.
And I have seen many cases when the iris hooks are put in the clear cornea.
Yes.
And it's good that way, but when you do phaco, they are not so comfortable.
Yes.
Being behind is more comfortable to maneuver the instruments inside the eye.
So whenever I try to teach the steps, I think I try to teach it with some logic behind, like why you are doing this. So you can, for each technique, I think there are different ways to do it, and it's okay. You can try doing different techniques, but there has to be a particular logic behind it.
Exactly.
So how do you find that? Have you improved your analytical skills over the period?
Yes. I think a little different.
Yes. Now, because you will be in a different situation when you are doing surgery in real life. When you go back, when there is no supervisor with you.
Exactly.
And at that time, really what helps is these analytical skills, because you cannot do 1,000 surgeries under supervision. You can just do few. But when you learn this analytical technique, I think once you know how to analyze that situation, you can use that in 1,000 cases. You just don't need any supervision.
It's important to observe the mistake. If you are
Right.
doing the
Yes.
part, stop and think fast what to do to resolve that mistake.
Right.
This is the important. And when something is not going, like for example, you have a soft cataract and you do a ball and you cannot extract
Yes. Yes.
the pieces, you must not try to extract. You must to stop,
Start thinking, analyze the situation, and then do it. That's very important, and that will help you in your long career. And we wish you from our side all the best for your future career.
Thank you
very much for coming here. We are very happy with your progress, and I'm sure we'll be in touch in future
Yes.
also. And all the best for your trip back home. I think you are
Thank you.
missing your home, so
I'm missing my home.
yes, and give our regards from our hospital, the entire team of Nandadeep Hospital.
We have a wonderful team here, and they are very good in everything they do, and they support us very well through this process of learning. That is important to have people who know what to do
That is very important.
and
So,
to have
thank
good
you.
good teacher.
Yeah.
If you don't have a good teacher, you don't feel you put your hands and you
Somebody
don't
to
progress.
push you always. Yeah, yes, you can do it.
Yes.
Yes, that
And you-
encouragement and that has to be.
You progress, and you when you have near to you a person who is positive and give you confidence.
Yes, I think that's very important. And for that matter, I think Dr. Nidhi, me, Dr. Umesh, and all of us were
All of us.
there, and it's a team
Yes,
because
all the team.
teaching is very exhaustive thing, and we have to work with you all the time,
Yes.
and the team is very useful. And I'm glad that you appreciate our efforts. Even our staff members were there all throughout in our operating room, helping you with the instruments and everything. So thank you so much for the appreciation, and all the best.
Thank you.